In the shadowed corridors of ancient Egyptian tombs, mummified remains reveal a silent witness to humanity's oldest adversary, tuberculosis. Radiocarbon dating confirms TB bacteria in 4,000-year-old skeletons, its insidious presence documented in Egyptian medical papyri as consumption, a wasting disease that drained life from the body. By the 1800s, TB had earned the grim title, the Great White Plague, claiming 1 in 7 lives in Europe and America. But this was no mere coincidence of poor sanitation. It was a microbial predator exploiting crowded cities. In 1882, Robert Koch's microscope revealed the culprit, Mycobacterium tuberculosis, a bacterium with a waxy cell wall that shields it from immune attacks. This discovery, verified by countless cultures, marked the first time a disease could be traced to a specific microbe, a turning point in medical history. Today, we visualize TB's progression through the body. A cough begins as a symptom, but the real battle unfolds in the lungs. Blood flow morphs into infected tissue, showing how bacteria multiply within macrophages, the very cells meant to destroy invaders. This isn't speculation, it's confirmed by modern imaging studies. As the infection spreads, it can travel via the bloodstream to bones, kidneys, or the brain, causing symptoms like night sweats and weight loss. But TB often hides, lying dormant for decades. The World Health Organization estimates 1.5 billion people carry latent TB, a silent reservoir waiting for a weakened immune system to ignite. Prevention is our first line of defense. The BCG vaccine, developed in 1921, remains the only tool against severe childhood TB, though its efficacy varies globally. Public health campaigns now focus on early detection. A simple sputum test, visualized through doctor-patient hand morphing, can identify active cases before they spread. In high-risk communities, airborne precautions, like UV lights in hospitals, reduce transmission by 50% per CDC data. But prevention isn't just medical, it's societal. Overcrowded housing and malnutrition fuel TB spread, a fact underscored by 2023, who reports linking poverty to 30% higher infection rates. Treatment, once a death sentence, now offers hope. The standard 6-month regimen, rifampin, isoniazid, pyrazinamide, Ambutol, works by disrupting bacterial cell walls and DNA replication, visualized as liquid morphing through the bloodstream. This protocol, validated by decades of clinical trials, cures 95% of drug-sensitive cases. The drug resistance complicates the picture. Multi-drug-resistant TB, MD or TB, requires 18 months of toxic drugs, with a 60% success rate. The WHO warns that rising resistance, driven by incomplete treatment, could reverse decades of progress. Historically, TB shaped society. In the 19th century, sanatoriums, remote mountain retreats, were the only option, with patients cured by fresh air and rest. The 1940s brought streptomycin, the first effective antibiotic, but its use was limited by cost and side effects. By 1950, TB deaths had plummeted by 80% in the US, a transformation captured in public health archives. Today, life expectancy in TB endemic regions has risen by 10 years since 2000, thanks to better diagnostics and treatment access. Yet, in 2023, 1.3 million people still died from TB, a stark reminder that progress is fragile. The fight continues. New drugs like bedaquiline target dormant bacteria, while AI tools predict outbreaks before they spread. But the most powerful weapon remains human connection, a doctor's hand, morphing into a patient's, symbolizing the partnership that turns diagnosis into hope. As we stand on the brink of eradication, TB's story is not just about bacteria, it's about resilience, science, and the enduring human spirit to heal.